Welcome to our series, Moving America Forward. Each week we'll be focusing on America's entrepreneurs as they take us to new roads, new opportunities, new ways to fill the gaps left by today's failing companies. Our series will be looking at that and a lot more. So come with me and watch as the entrepreneurs of our nation move into the future.
And I'm Doug Llewellyn here in our studios in Los Angeles with our guest today, who happens to be the founder of a medical practice called Second to Creation Plastic Surgery. He's based in Ontario, California. I'd like you to meet him now. This is the practice of Dr. Brian Machida, who specializes in facial restoration. Doctor, welcome. Nice to have you with us. How are you today?
Thank you, Doug. It's a pleasure being here.
Listen, before I get into this interview with you, a little while ago, you had a chance to answer some questions from William Shatner, so let's pause and take a look at a brief portion of that and see how it went, okay?
Okay.
Let's watch.
You are certainly in an interesting business, but take a moment to describe to me exactly what you do and who you do it for and how it helps move America forward.
Mr. Shatner, even though we all age, many of us still feel young inside. We want to look refreshed, energetic, and active. I specialize in facial rejuvenation, and as a cosmetic surgeon for many years, I've performed over 5,000 facial procedures, which has helped the patient turn back the clock and match how they look on the outside with how they feel on the inside. That, Mr. Shatner, is how I'm helping to move America forward.
You know, Doctor, that's really fascinating about what you had to explain to Mr. Shatner about your practice. I know it's rather unique that you specialize only in facial restoration. You know, so many plastic surgeons do all parts of the body. Why did you decide to focus specifically on facial restoration?
Well, it's my love of the anatomy. I decided very early on that I wanted just to specialize in the face,
right,
even just after medical school. And doing the cosmetic surgery was just a part of that.
And when we talk about facial restoration, what all kinds of procedures are we actually talking about that you perform that deal with the face?
Well, we do facelifts, eyelid surgery, brow surgery, facial fractional laser rejuvenation, and fat transfer, but primarily just focused on the face only.
So when a patient comes to you, what do you think essentially they're looking for? Are they looking for the fountain of youth?
Well, a lot of times people don't know what they're looking for. They look in the mirror and they see, all of a sudden they see their mother or their grandmother, and they realize that the years have gone by and all of a sudden something's gone. They see themselves as being younger than they actually are. And our job is to get them restored and transform back to close to what they were before.
And you know what I find very interesting is that you were explaining to me that were, 10 years ago, maybe even a little bit longer than that, maybe not quite as long as that, plastic surgery was something that only the extremely wealthy could afford to do, but now it's become something that the everyday, ordinary, average individual can actually enjoy the benefits of plastic surgery, can't they?
Yes, Doug. We see patients from all walks of life: policemen, firemen, teachers, accountants, engineers, retirees, all walks of life, middle class, not just upper class. And it's very available to almost every walk of life now.
Even police officers, you said?
Yes, that's
cops
right.
Cops get facelifts.
Yes, they do.
Well, look, I have some pictures here. Let's take a look at some before and after pictures as examples of the kind of work you've done. So let the camera get down here. And you explain to me what you did during these various procedures,
well,
okay?
This first woman had a facelift and eyelid procedure done. So you can see the jowls, the heaviest neck, and the heavy lines called the nasolabial folds in her face. And if you see the after photo, right, she looks so much more refreshed, so much more energetic, so more youthful, and you can see the fullness, the loss of the lines, and she just looks brighter and happier.
I was just going to say happier. That's the word I get out of this. She looks happier.
That's exactly it.
Obviously a satisfied client. What about this patient?
This woman, you can see that she has heaviness of her neck, the lines, the wrinkles in her neck, the jowls, and the lines across her face. And if you look at the after picture, this is what I call a mother-daughter transformation.
Wait a minute.
Where all of a sudden you see the before, and now you see the after. The wrinkles, the lines are gone, and she looks so much more youthful, so much more refreshed. And on the next set of pictures, you can actually see something about the sides of the face. She has heavy wrinkles on the sides of her face, heavy wrinkles there on the cheeks. Yeah. And afterward, you see that the wrinkles are just almost gone. Now, there's an interesting story about this. We had a similar patient to this. She actually went shopping with her daughter, and not this patient, but she went shopping with her daughter, and the checker asked, "Would you and your sister like anything else?" So her daughter was, of course, very, very much dismayed at that comment, but it just goes to show that's the kind of transformation we try to get.
Made her day, for sure. How about this lady?
She had heavy jowls in her cheeks and her neck. You can see the lines on her face. She looks tired, just tired. And if you look at the after pictures, there's so much more smoothness and youthfulness to her face. The cheeks are smoother, the neck is smoother. She looks a lot younger, a lot more refreshed.
In this picture,
well, this is a younger woman who had the heavier lines in her face and her jowls, and you can see them on her cheeks primarily. She had heavy lines, and if you look at the after picture for her, her lines are a lot smoother. Wow. She just has two cute dimples there. And interesting story with her, and a very common story with a lot of my patients is people come in and they want to have a job interview, and they're very knowledgeable, they're good at what they do, but yet they're judged based on their appearance, and they compete against younger people.
That's true.
So in this case, her goal was to be able to compete against younger people on job interviews, and I think she got what she wanted.
Good. That's very good news. And this answers a question I was about to ask you. Do you do men as well?
We do men too, and you had some heaviness of the eyes and the lower eye bags, and heaviness of the eyelids, as well as the jowls in her cheeks, on the cheeks. So he had a facelift and upper and lower eyelids done, and you can see there's an improvement in the jowls and the upper eyelids, and of course the fat that is in the lower eyelids is gone.
Tell me something. How long does a typical procedure like this take to recuperate from? They come into your office, and then how long are they kind of, got to be careful about going outside?
It's usually about 7 to 10 days, so it's a very quick recovery.
And the other interesting question is when a client comes to you, do they understand what they can actually get? Do you go through it with them of what you think you can do? Are they asking you what you will do? I mean, how does that work? Do they tell you what they want, or do you tell them what you can do?
Well, it's both ways, Doug. It's both ways. People come in and they have a certain idea of what they want, and I show them in front of a mirror with their face, with their anatomy, what's possible, and we work on it from then on.
What is really difficult about dealing with the face that you have to be so careful about? Because, I mean, that's it. You only have one face, right?
Well, people want to look natural. That's the thing nowadays. People want to look natural. They don't want to look done. And our goal is to make it look very natural, almost as if people don't know exactly what you had done. Most of my patients, after they've had it done, from their friends, they get the remark, "Well, you look great today. You look so much more refreshed. You had a nice day's vacation." Or, "I love the color of your blouse," or, "Your hair is different, I can tell." They can't tell that they've had surgery done, and that's the whole point, to make them look younger, refreshed, energetic, but not have a done look like they've had surgery.
I want to point out, I know you are double board certified, which is a very interesting term, but it's very important in your field especially. What does that mean?
Well, it means that I've had two different types of training. One is a reconstructive type of training in otolaryngology, which focuses on the head and neck,
right.
And then an American Board of Facial Plastic Surgery, which focuses mainly on cosmetic procedures for the face alone.
The other thing that really impresses me about what you can do is you realize you have the ability to change a person's life, don't you?
As a matter of fact, I was going to talk about that. When I first was in college, I actually wanted to be a pastor because I wanted to be able to transform people's lives on the inside. Once I became a doctor and became the specialty, I decided I want to help change people's looks and their appearance on the outside as well as on the inside.
I wonder if you hear back from many clients about what you've done for them, how it has changed their lives. Do you hear much of that kind of thing?
Well, I get feedback all the time, and I recall one story where I did a facelift on a woman who was in her late 40s, almost 50. Yeah. And she went out afterward with her girlfriend to a restaurant, and they had some cocktails, and the waiter carded her. She told me, "Dr. Machida, I got carded not once, not twice, but 3 times, 3 different places after her facelift."
I think that's really unique. That's one of the great benefits of all. I'm intrigued to know a little bit about the fact that you serve on medical trips. You've gone to Guatemala, you've gone to various foreign countries. Do you still do that? Do you get a lot out of doing that?
Well, I've gone to Jamaica, the Philippines, Guatemala, Brazil, to name a few places, and I'd say that it's a very rewarding type of trip to be able to go back and serve and help as much as I can in the world. And I get a great deal of gratification from that.
Do men want this as much? You talked about police officers and electricians and things like that, or is it still primarily women that are interested in facelifts?
Men are an up-and-coming crowd as far as this procedure goes, and I'd say it's about maybe a third men to two-thirds female. So it's primarily women, but men are still having it done.
And we pointed out that this is not just a procedure for the wealthy, but that it is a procedure. These are procedures that have been brought down so they're economically feasible, and that's a very important fact for people to know.
That's right. That's right. Because people should know that it's something that anyone can have done. It's affordable, and the most important thing when looking for a cosmetic surgeon is their experience. You have to make sure that you get someone who's very experienced. I've done over 5,000 procedures, including 3,000 facelifts, which is a great deal of facelifts, and they should look for experience as well as economy.
And when you talk about 5,000 procedures, that really is an awful lot. I mean, most plastic surgeons haven't done anywhere near that amount. So you've been doing this a long time.
It's way, way above average as far as experience goes, and yes, I've done these for quite a long time.
And I guess the real key is, after having done this for all these years, do you still love what you do? Do you still get the challenge out of it that you did in the beginning?
I just love being able to help people and help transform their lives to be closer to what they want to really be.
Well, it's certainly been a pleasure talking to you, Doctor. I didn't point out the fact you're a graduate of the University of California at Berkeley. You went to USC Medical School here in Los Angeles. You have an extraordinary, degree of background, and it's really been a pleasure to meet you and to talk to you about these procedures that you do. So thank you very much for being with us.
Thank you, Doug. It's a pleasure being here.
You're welcome. Now it's my honor to present this Prestigious Award to Dr. Brian Machida of the Second to Creation Plastic Surgery Facility in Ontario, California, for the outstanding work that he has been doing to help keep moving America forward. Doctor, it's a pleasure to give this to you. Thank you very much.
Thank you very much, Doug. It's an honor to receive this, and I really appreciate it. I'd like to thank my staff, my office staff, and my family, my wife Carolyn, and my rest of my family, Amy, Tommy, and Eric, for helping me move America forward.
You're very, very welcome. Thank you, Ken, Doctor.
Thank you.
That's it for another edition of Moving America Forward. I'm Bert Tenzer. Join us again as we continue to bring you the entrepreneurs who move America forward.
I'm William Shatner, and for all of us at Moving America Forward, thanks for watching.